Good evening and welcome to the Clinical and Translational Science Institute Translational Teamwork Shop Series. My name is Margarita Dubokovich. I'm a professor in the Jacobs School of Medicine and director of the Clinical and Translational Science Institute Workforce Development Core. The goal of the CTSI is to facilitate clinical and translational research across the Buffalo Translational Consortium with a special emphasis in developing strategies to increase knowledge in clinical and translational science and to reduce the impact of health disparities in our communities. We are grateful to Dr. Noyes for developing and leading this workshop series in translational teamwork. This series offers a CTSI certificate of completion for those who attended all workshops. The workshops will be recorded and made available to those individuals who can no longer attend a specific workshop. Dr. Noyes will present the first workshop on Team Science 101. Dr. Noyes is both professor and director in the Division of Health Science, Health Services Policy and Practice with the Department of Epidemiology and Environmental Health within the School of Public Health and Health Professions. Dr. Noyes is also the director of the CTSI Team Science Core that co-sponsors this workshop series and our Workforce Development Core. On behalf of the CTSI, we want to thank Dr. Noyes and her team for participating and for her support to the Team Science Core Competency Workshop Series. I would now like to thank Workforce Development Educational Assistant, Marshall Brooks, for outstanding support with the organization and management of this workshop series. And before we start with the workshop, I will ask Marshall to guide us in how these workshops will be conducted. Marshall.
Hi, everyone. So I previously sent you all a UB box link for this workshop series. This link will be used to post any supplemental materials if the presenter has any. These workshops obviously are being recorded. Therefore, if you're no longer able to attend a workshop, I will post the link to this video in the box folder. Only those who register for this workshop will be able to access this folder, and we ask that you don't send these materials, including the recordings, to anyone who did not register. During the workshop, I'm going to post 2 evaluation links in the chat. Please complete them at the end of this workshop. I will also send an email tomorrow reminding you all to complete these evaluations. These evaluations are completely anonymous and are essential to further improving our workshop series as a whole and reporting to our funding sources. Thank you for your participation, and Dr. Noyes, you can begin whenever you're ready.
Thank you very much, Dr. Dubokovich and Marshall. It's always a great pleasure and a lot of fun to teach such a diverse audience and share something that I am very interested and passionate about. I would like, before I start, I would like to introduce our program coordinator. Liz, are you there? Can you show up? Liz Bengert. Liz helped me design the materials that we're going to discuss today. She will also help me answer the questions. If you have any questions at any point during these presentations, please feel free to put them in the chat and we'll address them as soon as possible. Liz, feel free to interrupt me because I probably won't be following the chat. Once I have the slides on, I can't really see it. And we plan some interactive activities for you that hopefully will help you bring this material back to your home team if you're currently working on a team, or practice some of the team skills if you're only planning to design or build a team. And there are many more opportunities for learning about teamwork in science and medicine and education outside of this workshop. So if you want to learn more, we're happy to share with you additional resources and opportunity for training that are offered by other universities and also by other organizations within UB. All right, questions at this point? So at some point we'll break the big group into the small groups. And so I would encourage you when you're in a small group to put your camera on because it's much easier to communicate when you see the people in your group. For now, you can do whatever convenient since I can't see you anyway. All right, let me share my slides. And you tell me if you can see the slides. Can you see my slides?
Yes.
The slides, very good. Let me just say a few words how I ended up here on the call with you. So I'm a professor of public health, as you can see, and most of my work had been in surgical outcomes research and quality assessment of clinical services. I'm a health economist by training, do health services research, and never really dreamed about teaching team science, but because when I started as a researcher 20-something years ago, team science as a discipline didn't exist, at least in health and medicine. Apparently, as we learned later, it existed in social psychology. A lot of businesses and large corporations focus on incorporating teamwork principles in their work. The Army and the Navy primarily hired psychologists to work on improving teamwork in their teams. But in research and medicine, we didn't really worry about that. We were all about strong personalities, individual excellence, and it continued until the point that all the simple problems in research have been solved, and the complex problem requires complex solutions and multidisciplinary teams. And that's when a lot of conflict and confusion started to occur and needed solutions. And so as my career was expanding and I worked more and more with teams and experience research teams and clinical teams as we observe them, it was pretty clear that there's a huge difference in productivity, environment, burnover, and just general culture between teams that are productive and effective and teams that are really not teams, but just a group of people stuck in a room together and expected to do work. And so that opened my eyes and sort of required me to look more in depth of principles and fundamentals of teamwork. And I discovered a lot of interesting things that I would like to share with you today. And so throughout this series, you are going to hear from several people who are experts professionally in very different fields. Dr. Popescu is a basic scientist. Dr. Otaki is a rehabilitation physician, and Dr. Balkandi is a professor in the School of Management. So professionally, we do very different things, but how we do those things and how we work in teams are very similar. And sort of you're going to hear from this different faculty, and hopefully you'll find some tools and strategies that will apply to your own teams at home. And thank you very much for participating. So it's really an interactive workshop. And at any point, if you want to share experience of your teams, that would be great. So you don't have to listen to me all the time and hear about my experience. So before we start, if I stop sharing, I think I can do the poll. I want to learn a little more about you guys, and you can learn more about who else is on the call. So does everybody see the poll? So if you can please answer those two questions. So are you currently working on a team? Have you worked on a team in the past? You never work on a team? And then in terms of your professional stages, whether you're a faculty, a trainee, or one of the staff or research support members. So we'll find out who our colleagues are today.
So Katia, can I ask a quick question?
Of course.
I know you and I were both in the team session last week. And I sort of asked the same question there, but there's obviously differences between teams of what I will call equals, like, for example, multiple faculty members coming together to work on a project versus, when I talk about my team, I'm talking about, I've got 12 to 15 like staff, students, postdocs, whatever, all working together, but there's more a hierarchy within that team. So I'm just curious, are you when you say team, are you focusing more on that team of equals or team of
we're going to talk about different teams, and so I know exactly what you're talking about. I'm trying to help one of the people with the poll, so give me 1 second and then I'll finish answering your question. So if any of you cannot see the poll for whatever reason, then just please post your answer in the chat. So have you worked on a team, and whether you trainee, staff, or faculty? All right, so let's see what we have. Do you see the results?
Yes.
Okay, I don't see the results, but that's all right. So, so most of the people on the call today are currently working on a team. So feel free to use example of your current team or a past team. It doesn't have to be. So there's nobody who never worked on a team. So you guys will probably be very experienced and may find some of the things kind of redundant. And then as far as the faculty and staff, so we have a pretty good distribution. So about half of people are faculty and the rest are the mix of trainees and staff. Very good. All right, so back to Lucia's question. So it's a very important question, whether the teams have a built-in hierarchy or not. And in reality, as much as we like to have teams where everybody feels free and equal, if you have a social hierarchy, like somebody is much more senior or much older or much taller, or however your cultural norms define social hierarchy, those people naturally will have more weight, at least initially when the team is formed. Same applies to organizational hierarchy. A supervisor and a mentee on the team may start with a very different relationship. So part of the skill of running a successful team or building a successful team is to minimize the social hierarchy and get as much as possible, as much as realistic, to the point where everybody is empowered to contribute to the work of a team. And so in my second workshop in a couple of weeks, when I talk about team leadership, we'll spend a little more time talking about how this hierarchy can manifest itself. But today, when we talk about just a basic team structure, it's one of the hierarchy is one of the diversity of the team. So the whole reason we work in the teams, because we want diversity. We don't want everybody to think the same. We don't want all people on the team having the same expertise. That's not a team. That's something else. And yet that diversity could create conflict, misunderstanding, and misaligned incentives. So what Lucia brought up is actually one of the fundamental reasons, it's sort of a double-sided sword, why teams could be so good and why they're so complicated. Because for all of you who are working on the teams, I imagine, or I suspect, if your teams would be wonderful and your team life would be rosy, you wouldn't be on that call because everything's already great. So if you're here taking the workshop, perhaps you did have some challenges on your teams, and perhaps you learned from that experience and you hope to learn more. And sort of hopefully through this discussion today, we can figure out how to overcome some of those challenges. But Lucia, please feel free to come back to this question. So if we're progressing and you're not getting any answers, then we'll come back and discuss. Good? All right. So let me reshare. Okay, so not that I need to convince anybody here, but if I wanted to convince you that teams can do pretty wonderful things, if you haven't seen this video, this is a Formula One race car, and here is a team of 20 technicians that's going to change tires and fill in the gas tank of this car in 3 seconds. So in order to show you the video, let me come out again of the share and share with you a video screen so you can actually see that in 3 seconds. Right? All right, and here it's gone, right? So if you go to the video, you can actually see it in a slow time and realize how much work was done in this 3 seconds by these 20 people and how carefully orchestrated every step of the way in their job is. So that is exactly why these people work on the team. So if you look at the second video, and again, if you're familiar with those videos, then please forgive me. So another example, so the first example, the Formula One example, is that 20 people on a team working together. So the advantage of the team is speed and precision. But that's not the only purpose of a team. There are a lot of teams that are very functional, but they never work together. And so relay is actually example of the teamwork when the people are not together, but they're passing on the handoff, that's what makes them the team. So let's look at the handoff experience of this team.
Fastest countries of all time.
Can you hear it now?
Into the blocks.
Yeah. All right. So we see the beginning of the relay. So in the yellow, that's Usain Bolt, the Jamaican champion. And Jamaica is the world champion team still since the London Olympic in 2012.
And there's the gun, Carter for Jamaica.
So
for the
pay
US.
attention to the moment when the first runner passes on the baton to the next runner.
Both of those passes weren't the best, but
so you'll see it 3 more times.
A little bit of a lead here, Tom. Gallon has done the job down the back stretch. Here's Tyson Gay for the U.S. Johan Blake for Jamaica. It's the U.S. and Jamaica right together. Here come the anchors. It will be Usain Bolt against Ryan Bailey. And here's Bolt and Bailey side by side through the home straightaway. And Bolt edges ahead. Bolt pulling away across the line. Jamaica, U.S. world record.
So it's only very short, 36 seconds, that it takes them to cover 400 yards, as opposed to 47 seconds that each of them probably individually can cover the same distance. The whole benefit of this team is to be able to make that transition without losing the speed. And so I assure you that as much time as they spend training individually, they probably spend more time practicing those handoffs. And that's what makes their team strong. And so when we're working on our teams, we don't necessarily think about handoffs, and we don't necessarily think of the order of the team, but that eventually, at the end of the day, that's what makes or breaks the most successful teams. And so if we want to define a team, and again, so in the context of the workshop today, we're using the word team in sort of a more the scientific way, not like a sports team or just 5 people going out for a barbecue, it's a team lunch, but team as a functional unit. And so the characteristics that make team a team, most importantly, their interdependency. In all the examples that we saw, and I'm sure in the examples in your own work, if people can accomplish that work alone, they don't need a team. They may like the company of other people, but it's not necessarily for their work. And so the focus of interdependency and complementary skill is one of the most important characteristics of functional teams. The second important characteristics, as Lucia brought up early, is this concept of psychological safety, that people are on a team not because they were ordered to be on a team, not because they were forced to be on the team, not if they're going to be fired or they'll lose a bonus if they're not working on the team. They are on the team because they want to, and they feel comfortable doing their best work, sharing, whether it's a handoff or productivity or sharing resources, and being on a team makes them more productive than working alone. And so because of that, we really have to be realistic. And so there are lots of activities that as a researchers or as a clinicians or administrators, we can accomplish better alone. So because of the focus on teamwork, you don't need to feel the pressure that every single thing you have to do in a group of other people. It's really a very careful sort of risk assessment and decision. Which are the functions and the programs that require teamwork, and which are the other activities that you're more flexible and more efficient to accomplish alone. So for today, we focus on activities and programs where we really need the teamwork, either because we're lacking the skill, or we're lacking the time, or we're lacking resources. There could be many other reasons why we choose to have a team. And so this coordination, team coordination, it's something very different from what we mean, again, in a layman language. So coordination is, I'm not scheduling an appointment. Coordination is, I'm sharing resources. And we'll talk more about it later. Again, there are lots of myths and misconceptions about what teams are and why we work on the teams and why we don't work on the teams. And teams doesn't mean that you have to give up excellence, or you have to limit your strive or your goals so that nobody feels hurt. That's a bad team. That's a bad composition and very inefficient use of individual people, expertise, and resources. As you saw with the relay, those four athletes were phenomenal runners. And in individual competition, they will do very well. But for relay, they need the team. And that's what makes them work together. Same with Formula One. If you send everybody to do their work alone, by the time you fill in a tank and change 4 tires, all the other teams are going to be approaching the finish line. So this need to do work simultaneously that's what requires them to organize this very careful dance around the car, calculate their positions. As you see, the floor was marked, so everybody was standing exactly in the spot where they need to be to accomplish their function. And sort of a lot of planning and training went into doing their job as a team as opposed to alone. So if we talk about team formation, it's important to recognize that it's a process. Even the most fantastic and efficient and expert teams cannot be formed instantly. And there is a little bit of a thinking that has to go into formation of the team that plans to be effective. So first of all, we need to think about the tasks that our team needs to be accomplished. The team to serve a Formula One car is very different from the team to run the relay. So it's really the team composition is driven by the task or the goals that the team is charged to accomplish. But that's not enough. When we're bringing people on the team, the people need to understand their motivation. Why do they want to be on the team? What is it in it for them? Because that interdependency relationship and that balance that they need to be able to give their time, attention, resources, it only works if they also feel adequately compensated for the time and their contribution that they're receiving. So, and motivation could be intrinsic, extrinsic. I like to work with people. I would get a promotion if I work with people. It doesn't matter what the motivation is, but it has to be clear to every team member. Why are they on the team? It's often important to talk about where team will meet, because disagreements and resentment that, oh, we always have to go to downtown campus, or we always meet on South Campus, even though it's out of my way, factors like that could make or break a team. Just like the motivation, it's important to understand why this task needs to be accomplished with the team. Because if any single person on the team believes that they can accomplish this task alone, you can imagine they're not going to be a very productive contributor. And of course, for coordination of a team, it's very important to agree how we're going to interact, when we're going to interact, when we're going to meet, and how we're going to work together. Another common misconception about teams, that if you form a team appropriately, you can put together very mediocre individuals and still receive excellent results. And as you can imagine, that's not true. No amount of composition and careful formation and handpicking people with no skills, interest, and expertise will compensate for the lack of skills. So the perception is that only untalented, unmotivated, and unimaginative scientists need to work on the team is a mistake. Bright and motivated and very successful people also work on teams. And if you look at the most successful people in your field, and you look at their publications, you will probably realize that they have more co-authors or co-investigators on their grants and their papers than their least senior and least productive colleagues. So another longitudinal process that needs to happen after formation is team development. So we pick the right people, but they probably won't be able to work together on day one because they don't know how to work together. And so that process of figuring out how we're going to work is also a process. And people could be trained to shorten this time. So if you imagine a surgical team that meets at 7 a.m. in the morning and they have a case in front of them and patient is under anesthesia, so they maybe have 3 minutes to form, storm, norm, and then perform, they could do that because they've done it many times before, but probably with a different partner. A surgeon may work with this anesthesiologist last year, or this nurse practitioner or a resident or another staff person was on this OR team, but every time it's a slightly different composition and it's a different case. So there are rules and protocols that has been developed to facilitate this process of forming, storming, norming, and performing in a short time for traditional teams, nursing teams, Army units, airline pilots that also have to work in teams. In research, it's much harder because every team is unique. There's unlikely to ever be another team like yours solving the problem like yours. So in the research team, we fortunately or unfortunately have to dedicate some time to this stage of formation. And think about it. If you work as a team of 6 for many years and then 2 people left, let's say your graduate students graduated, it's not quite forming a new team, but you may end up going through the stages of storming, norming, and performing again because the roles of the team has changed. Their relationship may change. Your responsibilities and your expertise may need to be reallocated on the team. So don't think just because you and some people work together on a couple of projects, if you change the project or you slightly change the composition of the team, you may still be comfortable. You'll be surprised how much change, departure, or addition of new team members can cause on a team. Any questions at this point? All right, moving on. So let's try to define what effective team looks like. So we talked about diversity already. We talked about hierarchical diversity. Somebody's senior, somebody more experienced, or somebody's surgeon and somebody's anesthesiologist and the nurse and the resident. But there are other domains of differences on the team. So some of it are people preferences, their natural characteristics and preferences, what they like to do. So some people are more creative and they like to generate ideas and it comes easy for them, but they have a hard time following through with their ideas and they really never complete the projects or focus on the details. Other people like sales personality or marketing personalities may be phenomenal at finding individual approach to motivating people, but they typically don't have great ideas how to advance the project, or they may not know enough about all the aspects of the project. So when you look at your team, it's important to understand, do you have all the right personalities? Because if your team is slightly one-sided, you have a lot of creators, but no executors, you're going to have a hard time meeting the deadlines. Or if you only have executors, then you probably not be very creative and innovative team. And so you may need to bring members not only based on their job title, but also based on their personality and their natural tendency, how they like to work. So you can slice personality many different ways. Many of you are probably familiar with DISC assessment. That's another way how people communicate. So they may be action-oriented, they may be motivated by results, they may be motivated by challenge. So again, there are many different levels of variation when several humans get together for work. So how do we know who do we have on the team? Because obviously, in order to make appropriate composition, you need to know what you have. And very few of us walk around with a sticker on the foreheads saying, I'm a creator, or I'm an executor, or I like to be stimulated by challenge or by praise. So when you start working with people, you may get to know them better. But if your project has a definitive timeline, you may not achieve that timeline, but just naturally learning about your team members. So sometimes we use tools. So fortunately, there are a variety of different tools that could assess people's attitude and preferences for teamwork. And so clearly, if you bring together several world experts, but each of them by either by attitude or by personality prefers to work alone, that team of experts is not going to become an expert team. They're going to be butting heads. They're going to be fighting for power. They probably are not going to be very good at sharing. Sort of the team qualities are unique qualities. That's why we have team training, that you can actually train people to become better at teamwork. But some people are natural at it, and to other people, it doesn't come naturally. So when it comes to teams, we can assess person's individual attitude for teams, towards teams, and also their role in functioning of the teams. And here comes another myth. So for people who rarely work on teams, there is a perception that a team where everybody gets along and likes each other is a successful team. In reality, if you closely observe the most successful team, you will see how much time people spend arguing, debating, critiquing each other's approaches, because the truth, the innovation, the efficiency, it is not something that may come naturally even to the team. It may require multiple iteration. It may require tweakings. We all have different expertise and perception. And maybe most of us, I am definitely having a hard time critiquing my own writing or recognizing flaws in my argument. And so it's much easier for me to write a paper, or write a grant in the partnership with somebody. I would read her writing, that she would read mine. So teams is not necessarily about peace and harmony. Teams are about complementary skills and being able to challenge each other and improve overall productivity by productive criticism and follow through and compensating for other people's weaknesses. So in the clinical practice, they developed a whole curriculum for clinical teams called Team Steps, and you can find it online and if you've never seen it before. And so the Team Steps curriculum has a lot of very useful checklists. So this is clinical handoff. So when patients in the hospital changing from one unit to another, or you're passing patients from one provider to the next. So if you, for example, going to see an orthopedic surgeon, you may get an x-ray first. So you'll see a radiology specialist, then you may see a nurse, then you see a surgeon, and then you may need to see PT specialist. And sort of this handoff, I pass the baton, was specifically developed for clinical teams. And as long as everybody involved in the handoffs knows the order and knows the protocol, using this checklist really guarantees smooth handoffs. And so if we're talking about research teams, the typical handoff is a grant writing. I write the specific aims, you write the budget. But the budget has to reflect specific aims. And if I change specific aims, the budget needs to be updated and the sample size needs to be updated. So if there are several people writing different sections of the grant, we have to agree on how often we're going to check in with each other, how we're going to inform each other about any changes in the pieces that we are going to control, and how often we're going to pull it all together and make sure that things still hang together. So if you think of any of the team projects where you've been involved, you may recognize those situations where you actually did a handoff. You just didn't think you did the handoff if it worked well. If it didn't work very well, you probably still remember about it. So there are many other aspects of teams that we may need to test before we're ready and we're convinced that we put together the right team. So team structure may be important. Team leadership is frequently very important. Even though most teams don't have a hierarchical structure, as we talked about, team leadership is not assigning roles and assigning tasks. Team leadership is mostly about process. How we're going to change responsibilities, or how this team is going to discuss disagreement. That's what team leaders do, rather than telling Mr. Jones, you're going to do A, and Mrs. Brown, you're going to do B. So Mr. Jones and Mrs. Brown have their unique skills that they're bringing to the team, and that's the only, and sort of, they don't have other skills. So that's what they bring regardless. We don't need to assign them roles. But how they're going to share, how they're going to communicate, that is really what the team leaders may do. Empower them to be more open, provide criticism if they, for whatever reason, not really pulling enough of their weight, or perhaps taking too long or too short. And again, we can talk more about team leadership in a couple of weeks. So there are also ways to track team productivity, because in many situations, not only in research, but in the clinical practice, team put together and function for some period of time. And so it's important for the team to assess their productivity, because that's part of a teamwork. If we're slower than we expected, we need to detect it in time. If we're lacking a very important expertise on the team and everybody noticing it, it's important to pause, recognize that, and bring that missing expertise on the team. If there's a problem communicating, if there's a problem sharing, if there's too much sharing, those things need to be addressed. So a team is a living organism. It's not formed, set in stone, and then lasts forever. It forms, evolves, has a self-regulatory mechanism that the leader of the team hopefully will reinforce. And then once it achieves its goal, it may naturally fall apart, and then other teams will form to achieve new goals. And so this diagram, however complicated it may seem, is really here to reinforce this process of team productivity. So if we start on the left, that in order for the team members to work together individually, they have to be ready to collaborate. You can't take a person who is antisocial and anti-collaborative and force them on a team and expect a wonderful performance. So if we have some kind of inkling that some of the members that needs to be on the team are not ready or not properly trained, then perhaps before we put them on the team, we need to work with them and coach them on the expectations of what the teamwork will require. And so they have to be ready and they have to be willing. Then the next step is sort of what we call collaborative capacity, but it's when people are ready together and they're actually working together, and we continuously monitoring how the team is performing and adjusting the composition or adjusting the skills or adjusting the tasks, but that's their capacity, they're collaborating. So those two stages have to happen, the individual readiness and collaborative capacity, before we can talk about any outputs of the team. So very often the team is formed and nobody pays attention to those two initial stages. And the only first red flag goes up, then team is unable to produce output. The grant has ended and the paper is not written or the data are not collected. And so then it's already too late to change anything. And so that's why it's important to look at the team formation is this longitudinal process. And so early on, we still have time to make changes, to change the composition, to change the skills, to coach people, to provide feedback. We don't wait until we produce or don't produce the output of the team before we make any changes or reevaluate the team performance. Okay. All right. So let's go and watch the video. And then after the video, I guess I can give you that choice. So we can watch the video together. And then you're going to be going into the small groups and then you'll talk and I'll show you what the questions are. So once you watch the video, it's a case of a real clinical practice. And so what I want you to think about, and if you look in your UB box, you will see the discussion guide information there as well. So I want you to, as you watch in the video, track the team members and identify team members with different roles. And the roles could be defined based on any of the dichotomies we discussed today, based on their personality, based on their skills, based on their personal preferences. So is somebody a leader? Is somebody a critiquer? Is somebody is the cheerleader? And then what is it about their roles or what about their behavior that tells you about their roles? Then the second question, that's probably when you finish watching the video, is what developmental stage this team is. Is this team newly formed? Is this team storming? Is this team performing? Are you observing multiple stages? So think about that. And then the last question as a reflection. So what is it about this team that allowed them to complete the task? And sort of I'm giving up the secret that they did end up working very well. But what unique characteristics of this team that contributed to that success, that if those characteristics wouldn't be present, where would you expect things to fail? And in reality, sort of things fail much more often than they succeed. So the same characteristics, if it's there, could drive a success, and if it's not there, could drive a failure. All right. So these are the questions. So let me switch. So we'll watch first, and then we'll go into small groups. Is that okay? All right.
James and Schwartz, how may I help you?
Can everybody see and hear a video?
Yes, we're good. Yeah. All right, feel better, Caroline. I'll pass it on. Excuse me, Dr. James?
Yes, what is it, Emily?
Caroline just called in sick, and she's the triage nurse today.
Okay. Do me a favor, gather up the staff. We will need to do a quick huddle at the front desk before the day begins.
Got it, right away.
Okay, perfect. I'll be there in 10.
Okay.
We're swamped today. It's flu season. We don't have time to stand around.
I know, but Dr. James called this huddle. He should be here any minute.
Good morning, everyone. I need to tell you that Carolyn called in sick and she was assigned to triage. So we have 3 providers here today, so we'll take turns covering for Carolyn. During your triage shift, you'll see your scheduled patients every 30 minutes instead of every 15. Any patient you can't see will be passed off to another provider during your triage shift. That way we can ensure that anyone who needs immediate care is appropriately seen. Any questions? No? Okay. Be sure, everyone, to explain to our patients that the wait may be a little longer today, but we're doing the best we can, all right? Thanks, everyone. Let's have a productive day. All right, sir. If you'll just have a seat right over there, we will get to you as soon as we can. All right? Thank you.
We're going to see you right away, so why don't you come on back in? It's that first floor there on the right.
All right, sir. We'll get with you as soon as we can, okay? You can have a seat back in the waiting room for us. Thank you.
Excuse me, everyone. Can we have a quick debrief about today's events? Kelly, Sam, is that everyone? Yeah. All right, good. So, what do we think about how we handled our workflow today without a triage nurse?
I'll start. When I first heard the news this morning, I was a bit wary, but from the moment you called the huddle, I felt fine.
It was busy, and everyone was alert and acted as a unit. We seemed to communicate well and pulled it off just fine. I'd say it worked for us.
I'd agree with Dr. Schwartz. I mean, although this isn't something that I'd commit to on a daily basis, I think it would work as a last resort. I mean, we managed to come together as a team and support each other, and that led to a successful day.
I think it went well. Thanks for great leadership today, Dr. James. It helped us all ease into the situation confidently. Everyone appeared to be aware of what was happening and adjusted to make sure the patient's needs were met.
Don't forget Emily. She followed up with Dr. James immediately.
Thanks, Kelly. So if a triage nurse does call in sick again, should this be the plan of action?
That's a good question. From everything I've gathered today, this does seem to be a completely viable solution. So if everybody is comfortable with it, I think we should adopt this as the new default. Everybody on board?
I might just suggest that we have a provider or a triage nurse on call for this situation specifically. I feel that our patients shouldn't be passed around unless completely necessary.
Point taken, Miles. I'll look at the schedule, see what we can do about getting somebody on call. Anything else? All right. Well, excellent work today, folks. Let's close this place down and go home, all right?
All right.
All right. That was our happy case. Marcel, can you reshuffle our group into small groups?
All the breakout rooms have ended.
All right, fantastic. All right, so I hope you guys had a productive discussion. I eavesdropped on a couple groups, so it was very interesting. Let's share with the rest of our group what we discussed. So any team wants to start with question number 1? Raise your hands or speak up.
Yeah, I was able to identify all of the, most of the team members and what their roles were.
Okay.
And I could tell from the person who answered the phone, who was probably the person assigned that day to get the phone calls if the phone rings. And
Emily.
She reported to the physician leader, who was obviously the team leader for the group. There was also another physician and a physician assistant, and they were the nursing assistant and another person that I wasn't, another nurse. Yes, there was a nurse. So I was able to identify most of the roles. Based on those roles, I could see how they interacted and who carried out what roles and who made the primary decisions and who followed along with the decisions.
Yeah, so give us an example. So
well,
the main doctor, Dr. James, right?
Yeah.
That's the team leader, right?
Uh-huh.
And so it's a little bit easy here because you clearly see that his administrative role, so he's probably practice director, overlaps with his team role, team leader. But it's not always the case. So don't assume that just because somebody is administrative leader, they are also a team leader. There are lots of situations where it's the nurse practitioner on the team that leads the clinical team of physicians and residents. It's not uncommon. So, all right. So what about the other physician, Dr. Schwartz?
It said she was an internist, so I think that she was one that took care of all the patients and maybe was the leader for just the team that does seeing patients.
Yeah, you don't need to be a leader. So on this team, she was a team member, a clinician, right? So what did you think of Miles? So he's a PA. He's the one who suggested at the end the idea that they should really have somebody on call.
He might have been a little frustrated that this whole thing sprang on them, and he didn't really like the idea of shifting roles, shifting around the patients. He didn't think it was fair to the patients, but also he didn't really, he wasn't totally with it because he made that suggestion at the end that maybe we should think about having a triage nurse on call in case this happens again.
Yeah, so on the team, he may be the creative, right? He came up with idea.
Yes.
So what did the other team think about Miles and his role? So there's somebody who contradicts the leader, but he contradicted it in a productive way, right? He was sort of, he wasn't happy, he was skeptical, but that hopefully produced a better solution for this practice, given that if they can identify an on-call triage nurse, so next time in this situation arises, they don't have to scramble and reshuffle their own patients. They may actually get somebody for the day. So sometimes being critical on the team is not a bad thing. It can lead to a better solution or a better strategy. And in this particular case, that was Miles. What else did people observe? So let's talk about developmental stage. So where was this team developmentally?
Well, I mean, they seem like they were at like the performing stage because they were able to, in a small amount of time, shift their focus and be able to pull off successfully an entire day without a staff member available.
But, Amy, so what happens is, so they were team yesterday when everybody was healthy. This morning, they actually had to storm, right? Because lacking that person who was sick made them storm. So Miles was unhappy. Other people had to change their normal roles. So that, what you observe, was storming and norming. And then they agree how they're going to do that. It happened very quickly. And probably it helps that these people work together, the new personality. And I think Dr. James put just right amount of not pressure, but strategy. He probably knew his team and knew it was going to work, because if there were a couple more people like Miles who would object and slam the door and leave, they wouldn't end up with a successful day. But knowing that most people will probably be able to adjust their behavior, his strategy worked well for this team. And we saw storming and norming happen very quickly. And then we saw performing for the rest of the day, and then they adjourn, and hopefully next day the sick person will be back, and they will be back in their normal dynamics. Okay.
If I could just add, I took this as this was a mature team who worked together, and I kind of used the phrase they were reforming because they were missing one team member, so they had to just change slightly to cover that missing team member.
Yeah, I think what was interesting about this case, that missing team member didn't really have a duplicate, right? She was a triage nurse. So they had 3 clinicians, they have a secretary, but they only had 1 triage nurse. And so in addition to replacing a team member, they had to replace a role. So people who were not triage nurses had to perform that role. So in that sense, that's what really required the storming, the strategy of adapting and sharing that missing role.
Well,
and again,
I want to add just one point. I think it is very remarkable that the team under stress was ready for a collaborative form of work. I think that is because I think there has to be a culture of shared goal, that has been ingrained in them, so that this collaborative capacity or readiness comes immediately for them to respond. Otherwise, it would be tough for them to do this.
That's a great point, Dr. Kumar. And so that brings us to a third point, sort of what was it about this team that led to success? And maybe, we don't know, we didn't observe that, but maybe it's a shared financial practice. So they perhaps all the revenue comes together and they share practice revenue at the end of the month. So it's not that every physician eats what they kill. So there was perhaps an additional incentive for them to change their behavior and not to lose patients and revenue in their face. But in different teams, it's a different motivation. So in research teams, very often, it's PI whose name is going to be on the grant. But the money from the grant are going to pay for everybody's salary, and the research assistant and the graduate student and the study coordinator. So again, depending on the team, the incentives may be different, but it's very important to understand what the incentives are and highlight them and appropriately articulate them, so that for anybody who is skeptical, not fully committed, perhaps it's the very tailored approach that can make people more committed and more willing to go with a team strategy. Okay. Any other comments or reflections on this case?
I thought that they didn't have hierarchical barriers. You had a young African-American male, an older physician, a female physician. You had other, so there was, and you could see where different hierarchy could develop because of that. But I felt that they really didn't have it. Everybody's voice mattered, no matter whether they were a senior physician or the receptionist, who's probably the most junior on the team.
Yeah, that's a very good point, Bob. And so did anybody capture sort of, was anything unique or anything somebody said or did that gave you that feeling of psychological safety?
Well, it was almost as things were delegated equally amongst everyone. It wasn't like they segregated out and said, hey, who's got the lightest schedule here? You can take more patients. So it was an even distribution amongst everyone. It was kind of like, it seemed like it was going to be like a round robin. Whoever came up next, it was just...
Yes. Right. And so because the practitioners were at different level, right? There was MD, RN, and PA. But the strategy was the same for everybody. So there wasn't, okay, you are MD, you're more senior, you'll take more, sort of, it was equal. And then the language, if you ever have time to re-listen to this case. So when then Dr. James first learns about this situation, his language is, let us have a strategy. So it's a very inclusive language. It's not the language, okay, guys, this is what you're going to do, I'm telling you. It was, whatever he said was collaborative. It was suggestive, but not pushy. He was open. He sounded like he was open to suggestions. And then this idea to debrief, that was also something very helpful. How did we do? Not you did. How did we do as a team? That again reemphasizes that culture, that we are a team. Because when it comes to culture, culture is not something that's very easy to measure or put a sticker on. culture has lots of unspoken rules and nuances and things that we as humans can sense but can't quite explain in words. And so that's what makes it so difficult to create a team culture, that it's not a one thing that everybody should do. It may be a different thing for different team or in different time. But when you see it, you know that this is a team. All right, very good.
Sorry, I have something to say. I think that they also acknowledged each other. They recognized that they did a good work, and they say, okay, you did this well, you came up with a solution or whatever. And I think that that's also important, and maybe that could be one of the reasons why everybody was committed and willing to help.
Positive reinforcement, yes, and acknowledgement of everybody's hard work. They say, well, it was tough, but we made it, right? Yeah, so totally. Okay, very good. So let me quickly share with you a couple other examples of a teamwork. So as you can see, there are numerous teams, big and small, and those who line up for the portrait and those who just have a drink. But in teamwork, universally, clinical teams or military teams, researchers came up with this 7 C's of teamwork, basically 7 important criteria that need to be addressed for the team to function. And so in our sort of colloquial language, we call everything team communication or team coordination, but there are actually 7 conditions, not 2. And it's important to recognize them, because when you're trying to diagnose what's wrong with my team, it's important to include all 7 and not expect that by default it's the communication problem. That's what most people will think. So the first important criteria is competence. You have to have the right expertise. And so in this team, the important person, the triage nurse, was missing. So they had to compensate for those important skills by using skills of other people who were not necessarily triage nurse by qualifications, but had some skills and were able to do that. So the cooperation is what we talked about, the right attitude and willingness to team up. People were willing, they quickly changed their strategy, they rescheduled their cases, they put a little more time, but they were cooperating. And that's something that doesn't happen on the spot. That's part of a personality, that's part of a training, that's part of attitude. And if it doesn't work, it could be addressed for additional training and coaching, but it couldn't be solved like this in a millisecond. So coordination is really this ability to use those team behavior, not only know about them, so not only receive the training, but actually express that team behavior. And in this case, it was primarily about leadership because they all work individually, but it was also critical. Communicating effectively and appropriately is actually, it often interpreted as talking a lot, but on many teams, it's actually talking less. So I can tell you that in surgical teams, there is a large body of literature indicating that if people sharing too much information, especially during emergency surgery, the quality is going to suffer. Team communication is sharing the right information at the right time. And so, again, we didn't observe this team for the whole day, but you can think that sometimes sharing too much or duplicating information or repeating things in inappropriate time or distracting people from their tasks by having unnecessary meetings and unnecessary huddles may be destructive. So it's finding that sweet spot where all team members have information that they need to complete the task without being distracted by unnecessary information. So cognition is all about shared mental models, shared goal, and shared motivation. And coaching is really about leadership, is having somebody who can recognize problems, recognize deviations, recognize lapse, and provide feedback. And so, again, coaching on teams or leadership on teams is not about knowing all the answers. If there is a person on the team who knows all the answer, that person doesn't need to be on the team. They can work alone. So teams are because if they're true teams and they interdependent teams that nobody knows all the answers. If they think they know all the answers, they have a personality disorder. But it's sort of about shared responsibility. And sometimes the role of the leader is to sort of calm down somebody who may be too aggressive or too pushy, and motivate or empower somebody who have important knowledge but too shy to speak up. Sort of addressing that team dynamics, that's really the role of the leader. And then last but not least, it's important conditions. And that's one characteristics of effective teams that we often forget. I think many people, at least many groups that I watched today, they acknowledge that this team was very collaborative, and it was not like the teams where they work. And that may be the culture of that greater institution. Or, as we talked about, it may be how these people get paid, but they get paid for the total number of patients they see, not for the number of patients each individual person saw. So there could be multiple factors that create that culture. But if the culture is in conflict with team mission, this team will have a terrible luck of being successful. And very often we blame ourselves individually, or we blame our immediate team supervisor for failure. But if you look deeply, it may be that the team was placed in the wrong environment. And you can all probably come up with situations where you want in that team that your goals and the requirements of your teamwork were in a direct conflict with what the rest of organizations were trying to do. It's like if you take a patient-centered medical home and put it in a traditional fee-for-service environment, it's going to be a disaster because they won't be able to accomplish anything. They won't be shared. They won't be able to collaborate. So this is just some additional examples for you of what we talk about when we mean coordination. So when this was an example of the clinical team, but for research teams, coordination could mean agreeing on use a shared drive for your drafts, so you don't have to constantly email each other information. It may be about prioritizing programmer time between multiple researchers so that each of them can complete their projects in time without overworking the poor programmer and demanding that they work overnight, but instead sharing days of the week. It may be sharing an expensive piece of equipment. There are lots of different coordination strategies that help address team productivity without really requiring any additional money or any additional staff. And when you see a lack of coordination, then inpatient and outpatient services don't coordinate, and you start reducing length of stay on the inpatient side, you'll immediately see more utilization and longer wait for outpatient visits, because by discharging patients quicker and sicker, you don't solve the problem. You just pass it on to a different team member. It's also important to recognize that coordination on teams may happen on different levels. What a nurse and the patient can coordinate at the individual level may be very different from what a billing person can negotiate with insurance company. And so in order for the patient to get their care, multiple level of coordination may happen at the same time. So same for research project. If your graduate student and your lab manager, they need to discuss a lab space and their experiments on time. But if the materials and chemicals are not delivered on time, then the experiments will either have to be delayed or have to be ruined because the materials are not there. And if hospital is not providing the right equipment, or there are no patients scheduled for that we need to take a specimen from, again, no amount of perfect action of the small team would be able to compensate for the failure of the macro level coordination. So when you're looking on your projects, it's important to recognize the area of control of individual team members and plan to address different level of coordination with various people. So what the dean of the school has to do may be very different from the division leader or data manager will have to do, but all of them have to align their action in order to reach the shared team goal. I also provided a couple examples of positive teamwork and negative teamwork. And when you have time and when you get together with your team, you may use this framework of 7 C's to look at your teams and to reflect back of what made your team successful or unsuccessful. And you may be better able to diagnose the problem and solve them. Because just concluding that the team failed is probably not enough in the long term, because it doesn't help us do better next time. But being able to address a problem and avoid it with your next team or with your next project with the same team, that's really about team training and team evolution. I will stop now. I know we're running out of time, but I'll emphasize again that while effective teams are really great, you don't have to have a team for every one of your projects. We really hope that we can see you in our next workshop, which is in 2 weeks on October 18th. Thank you. I'm happy to stick around and answer any questions people may have. And if you have to go, thank you again for attending, and have a wonderful evening.